Hi guys, it's Claire again. Hi. I spoke to you last time about the fact that I was going to share with you one of my really life-altering nursing experiences that I had when I was a student nurse and I was working at a big government hospital in South Africa in Durban. So one day I was on night duty. I was a student nurse. I think it must have been, I was probably 6 months in, and it was just me and the RN in the nurses station, and the doctor was visiting the ward, and one of the patients had been admitted for gastro, and she was in a lot of pain and she was calling out. And so the RN asked me, can I please go and see what's wrong, maybe just give her 2 Panadol. So I went to her and gave her the 2 Panadol, and she had like beads of sweat on her face, and she was absolutely in absolute excruciating pain. So with that level of pain, you know, sort of Panadol's not really going to touch size. But anyway, we just waited a few minutes, didn't wait long because she was like really screaming. And then the doctor came to have a look at her, and he said no, that she's having a natural miscarriage. She had basically taken Muti to try and give herself an abortion. And yeah, so the baby came out, and it was about a 24 to 26 weeker, a little boy, and maybe this woman might have been raped or anything or something like that. That's why she, you know, we can't judge the people who do things like that. It was very sad though. But this baby was still living, and this little tongue was sticking out, and so the RN had asked me to go and get a receiver to put him in. So the sluice room had these big metal receivers, and I went and grabbed it, and the doctor put the baby in the receiver. I was holding it, and the RN said, just show her. And she didn't want to see it. She just didn't want to see the baby. I said to the RN, what should I do with him? She said, oh, just put him in the sluice room. And I said, are we just going to leave him in the sluice room? And she said, yes, if he's still alive tomorrow, then we'll take him to a neonatal ICU. The sluice room was freezing cold, and I had to take this little life, was still living, and take him and put him in the sluice room and leave him there. And to this day, I cannot forget that experience. I just keep thinking, could I have done something else to save this little baby? You know, obviously in South Africa that sort of thing is happening all the time. They have Muti, and people get raped. There's not much value. Life isn't valued as much as it should be in many instances. But this just sort of went against every grain in my body. Being a nurse as well, you know, I came into the profession to care for people, and this just sort of like was really, really disturbing, especially considering many years later when I qualified, I got a job in neonatal ICU, and babies that small were actually surviving. They were getting surfactant injected into their lungs so that their alveoli could expand and they could survive. It's very, very sad, because it's a well-known fact that African women suffer a lot more stress, you know, in their lives. And so the stress levels of an African woman increase her baby's lung strength because of the cortisol levels. It's apparently been proven. So this baby probably, you know, he had a good chance to survive. And we would find that as well, like at the Grey's Hospital, in the neonatal ICU, a lot of the babies were surviving. They didn't have to have the surfactant. A lot of them would actually just survive because of their lungs. Their lungs had been matured faster, as opposed to the more sort of like the Caucasian white women who were giving birth, and they'd maybe had easier lives or something. But honestly, I know it sounds strange, but it's a real study that's actually occurred. Anyway, I just thought I'd share that, and please can you post your comments, and maybe you've had similar experiences. Maybe you've had some experiences when you were nursing that you can't ever forget, where you felt that you could have done something differently, or that it just went totally against what your beliefs were. And you can share and comment. That would be great. Please can you like this video and subscribe to my channel, guys. I really appreciate you watching. Thank you. Bye.